My name is Shakeenah Bolden. I am the manager for our CareFirst Engagement Centers, and I have been with CareFirst for 4 years now. Our first one is at our CareFirst headquarters in Canton, and I am also the manager for that center. So that's kind of where I got my footing from a CareFirst engagement perspective. I have worked for many companies that are healthcare related, and my background is in appeals and grievances. So I come from a place where the goal was to resolve complaints and kind of figure out what the root cause was. So this is a lot more fun because it's not just a person writing something on a piece of paper that you never get to see. This is something where I got to meet this person, I got to feel the energy of this person, and I know that this person really needs some help, and what can I do to resolve this issue for this person? Because I know that this might be my next door neighbor, this might be, the person that my kids go to school with. So making sure that I always put myself in the shoes of that person, but now it's like a face-to-face thing. Like I get to physically see the person that I'm helping and make sure that they're taken care of. Our interaction with our customers is that we kind of build relationships with them. So you may, come in to get a copy of your card because you lost it, but then you get to talk to me about your family. You get to also tell me how you've been having, this chronic back pain, and your doctor said that you needed to do some more stretching. That's my plug to say, hey, you should come to our yoga class on Monday. It's free, and it can help you stretch out what your doctor told you that would be a good idea for you. So we definitely get to connect people with the care and the resources based off of, our engagement and us just kind of being personable and, being genuine about, our engagement with a person to kind of build trust. And you don't know how much people want to share with you until you kind of make them feel comfortable enough to be able to share those intimate things that triggers us to say, okay, how can I find a resource to help this person with what they've just told me? Not everyone from our team is a native of Baltimore, but everyone on my team has been in Baltimore for over 10, 15 plus years. It provides us the opportunity to kind of already know what some of the disparities are and kind of have an idea of the resources that we might be able to connect people to based off of what we've just learned from living in the community. Being a part of a community and being able to ask questions because I live in the community and I am very encouraged and I love to engage with people. That affords me the opportunity to kind of figure out what the needs are, and I can talk with my team about building programming based off of what people have told me their needs are. We had a member who came in who needed a new ID card, and she wanted to get some additional information about using her Flex card. During our conversation, she kind of told me that she had COPD and that she had not been to a primary care doctor's appointment in the past 5 years. Based off our conversation, and when I felt like she was comfortable enough for me to be able to ask questions, I kind of had to ask her, like, well, if you want to know more about this, is it okay that our case management team reaches out to you? They can give you some additional resources to manage your chronic condition. And she was like, yes. Everybody gets my business card, so she knows that if she ever has a problem with her CareFirst insurance, she can contact me. I'll make sure that she's taken care of because we provide personalized service. It's like a concierge service. I love the fact that we have the ability to take the time out to not only address the immediate need, but kind of figure out what you may need in the future and provide that for you as well. My hopes is that years down the road, when they do all of the fancy studies from all of the big universities, they will talk about how this hub has impacted the health of this community. They will talk about how they have seen chronic conditions decrease in this community. They will talk about how there are less social drivers of health that affect this community, how the people are healthier, how they are more financially literate, how they are happier, how they are helping to build generational wealth and generational health. That is what I see for this community in particular.